Good evening, everyone. My name is Simran Chaudhary, and I welcome you all to HeartWise Talks brought to you by Voice of Healthcare. In honor of World Heart Day 2024, we present our special series Heart Smart 2024 Act Now for a Healthier Tomorrow. This series is dedicated to empowering you with a vital knowledge about heart health. Our team Use Heart for Action reflects our commitment to promoting heart disease prevention, encouraging regular health checkups, and advocating for cardiovascular health priorities. And for today's episode, we have with us Dr. Prakash Kumar Hazra, the Team Director and Head of Cardiology at Manipal Hospital, Dhakuria. With over 35 years of experience, Dr. Hazra is a renowned heart failure specialist and a pioneer in cardiac interventions. From performing complex procedures like angioplasties and pacemakers implantation to leading innovations in minimally invasive heart treatments, Dr. Hazra has revolutionized heart care in India. Welcome to our show, Doctor.
Thank you.
Thank you so much for coming to a platform and spreading helping us in spreading the awareness of regarding heart health on this special occasion. So we'll be discussing on stress and heart disease, smoking, alcohol, gutka, and relation of all these two heart diseases. So with my first question, stress is often mentioned as a leading factor in heart disease. Could you explain how chronic stress impacts heart health?
Right. So stress is very important risk factor nowadays in aggravations of existing heart conditions, be it hypertension, diabetes, be it heart failure, or any other chronic illness. And how does it aggravate? It aggravates your existing problem by altering the gene and producing lot of stress on the heart. Stress is a new risk factor for all human beings, irrespective of the caste, creed, religion, race, ethnicity. Everybody is suffering from stress, some kind of stress, and it is harmful to human body.
Thank you, doctor, for that. And doctor, if you're talking about stress over heart health, so what are some of the early warning signs of heart disease that can result from long-term stress?
So commonest symptom is sleeplessness. That means the sleep hygiene is altered and people are not able to get good amount of sleep. So total sleep duration is reduced or the sleep quality also reduced. That means they sleep for 2 hours, 3 hours, wake up, and this cycle keeps on repeating. And this is at it basically at your heart level or brain level, blood pressure level, sugar level is harmful. So it is quantitative and qualitative loss of sleep can lead to heart disease and its related conditions, and it can affect the whole body as such. So we need a holistic approach, and the symptoms are fatigue, symptoms are sleeplessness, aggravation of your heart failure like breathing difficulties, failure to concentrate, failure to memorize, failure to perform, failure to comfortably treating patients with empathy and sympathy. You lose your patience, you get angry easily. So it has got many more aspects in day-to-day life, at home, outside home, with patient, outside patient. It has to be a multi-pronged problem, and it has to be dealt with multidisciplinary approach. Your family members includes your wife, children, your working stress, the working environment has to be changed, your colleagues. So a lot of discussions amongst yourself, introspection, and a counseling at the one at some point so that it can heal on its own.
Thank you so much, doctor, for explaining those are the very important signs that one should know about heart health if they're going through some stress and they are aware of that something may happen. So it's better they take precautions prior. And since we also wanted to discuss about the effects of alcohol, smoking, and consumption of gutka on heart health. So we often hear about the negative effects of smoking on heart health, But could you explain the exact link between smoking, alcohol consumption, Gutka on heart?
Look, any form of abuse of tobacco, alcohol, gutka, smokeless tobacco is harmful to human body because these are exogenous chemicals. And in smoking, you have a direct relationship with heart attack, strokes, aggravation of hypertension, loss of appetite, and alcohol directly involves the liver. So liver function goes down, and you become addicted to alcohol. Your social behavior changes. You become a social nuisance to your family, to your friends, to your daughter and your son, your members. So that is the behavioral part. But other than that, your liver and ultimately liver is very important for your long-term survival. And the liver goes into cirrhosis. That means your digestive power is gone, and your toxic levels in your body do not get metabolized anymore, and you do die early. The gutka, the smokeless tobacco, again is harmful for your mouth, that is oral cancer, and ultimately it is smoke. It is nicotine. So it is as bad as smoking cigarette. Indirectly, it affects the organs like your brain and heart. It cannot be separated from nicotine and smoking. It has got equally a bad effect on all the organs in human body. So, in summary, whether it is smoking, gutka, alcohol, or any abuse of any offending drugs, contrabands at younger age, starting from younger age, and quantitative and qualitative damage can happen if you smoke a biri, crude smoke, or if you increase the number of pegs or the gutkhas in a day or smokes in a day. It has got a cumulative effect. So maybe one smoke is little better than 10 smokes, but one smoke is definitely worse than no smoking.
You said it right. So it, like you mentioned, it does leave an impact on this. But there's one more thing, doctor, if you can clear this misconception around. Normally, whoever drinks alcohol or something, so they say, two drinks. So two drinks. Doctor also recommend it is good for heart or something like that. Just wanted to, if you can clear this. Is it this a myth misconception that alcohol is good whether they are having two drinks, one drink, or no, how many number of drinks? Is it good for Indian population or not?
Right. So we are talking about the quality of life and quantity of life. So if you really want to improve your quality of life, there are certain things is not prohibited, like small amount of alcohol, and taking fatty food or eating in a restaurant is not that bad, or a salty drink in a day is not bad. But once you start doing that repeatedly every day, and you cross the limit, then your quality of life becomes a pathological life, and ultimately your body suffers.
Hmm.
So some amount of alcohol, if those people are addicted to, if they get good sleep, good stomach, let it be continued. I'm not saying that they have to stop. So anything in moderation as far as the alcohol is concerned is good or bad. I do not know, but it is not that harmful like smoking or gutkhas. So alcohol maybe twice, thrice in a week, like 60 ml in a male, around 40, 30 to 40 ml in a female, adult female. It is not good for children, so it is not good for very elderly people. So those who are having a reasonable quality of life by having one or two pegs is not prohibited from my side. Now, the binge drinking, binge eating, and drinking and eating the garbage, I mean the junky food, sometimes can affect your diabetes, your uric acid, your salt intake can cause some problem with your hypertension. So it has got a cumulative effect on your whole body. It is just not alcohol itself, but associated vices with alcohol can cause real problem like food, and people start smoking with alcohol, and they do not know when to stop. So that is the main problem of asking people not to drink, not to start. if you have started, just reduce the number or increase the gap between two drinks. Like if you're drinking 5 days in a week, try to make it 2 days in a week or once in a day week. Do not drink at home. Do drink with your company so that do not become a habit in depression, in feeling low. So let it be like a restricted kind of lifestyle.
Thank you so much, Dr. Hazra, for clearing that out. Moving on, like we also discussed that smoking, drinking, or having gutka does leave an impact. So, how does gutka and the other smokeless tobacco products, what specific impact do these substances have on the heart?
So it can promote heart attack, it can precipitate heart attack, or it can aggravate the existing heart symptom like your chest pain or breathing difficulties, lung problem, your oral cancer, lung cancer, GI cancer. Any cancer can happen due to your gutka or your smoking or alcohol. It has got a direct effect on these organs as far as the malignancy is concerned. Now, the smoking has got other relationship with your metabolic syndrome like liver damage, kidney damage, your cholesterol level goes up, your triglyceride level goes up, your bad cholesterol goes up, and the good cholesterol comes down. So it has got many more effects on your lipid profile, your sugar profile, your blood pressure profile, your uric acid profile, thyroid, and many more things uh, can come due to your smoking, whether it's gutka or a nicotine or a churut. Biri also equally bad. The in-house cooking with your smokes, chula, and that has also a direct effect on the lung and the heart. So it is not always your nicotine or gutka. The home pollutions, like during your cooking, also can affect heart equally.
So, if someone actually wants to quit smoking, drinking alcohol, or the gutka, what steps would you recommend to our listeners out there, those who are struggling from these kind of habits? So, how can they quit to improve their heart health?
Look, there are some drugs now available. One of them is your semaglutide, Ozempic. It reduces the addiction rate by 50%. So these are the drugs for your appetite control, appetite suppression, weight control, obesity drugs. So these anti-obesity drugs can curtail the addiction rate by 50% for smoking, for gutka, and also for alcoholic binge drinking. Beside that, some counseling, and do not buy and keep these cigarettes or gutka in your home, in your toilet, in your car. Do not eat or smoke in a prohibited areas, in a working place, and do not come to your working place after having gutka. So those kind of introspections, feeling bad from inside, uh, can reduce the chance of going bizarre with number of gutkas in a day. And I would say that government can do a lot. There should not be any promotion by the government for gutkas. TV advertisement should not be there. And the
Yes.
problem is, a lot of heroes, they are promoting gutkas openly in our market. So there is tobacco lobby, there is gutka lobby. I can't do anything about it. So the society needs to take care of the people by prohibiting this kind of advertisement directly or indirectly. From our side as a doctor, we definitely tell them to quit, not to continue. Some people listen, some people do not listen. Now,
Yes.
for cigarettes, you have to increase the gap between two cigarettes, throw away the half smoked cigarettes, try to avoid cigarettes during your for your stomach clearance, or do not keep these cigarettes in your car, as I mentioned. And ultimately, self will to stop, to quit smoking and these vices is going to help you. It's not going to help the neighbors, and that's how it works.
Thank you so much, Dr. Hazra, for explaining how we should, if we're trying to avoid, what are the options available to us, and actually educating general public on this. And yes, government should not promote this open and all those advertisements should not come in openly where superstars are promoting this. I think government has made it mandatory that even on the this Netflix and such platforms, no tobacco ads cannot be skipped and then played. So I think new rules and regulations are every day coming up. Government is playing their part. So moving on with my last question, what key message would you like to convey to our listeners on Heart Day regarding lifestyle choices and heart disease preventions?
Like the most important is happy life and less stress in your life. So enjoy your life, listen to music, do some yoga, be with your friends, mix with your family members, spend time with your children, your wife, your spouses. Be happy in your working space. The place you have to create the ambience you have to create for your own. The societal change you can participate in community healing, and the government also can help us. The media can also help people to avoid these addictive agents, regular exercise, less eating, less carbohydrate, less fat, less junky food, less salt, sleep more. If you're suffering from snoring, take care of the snoring. The sleep hygiene has to be good. Your health hygiene, eating habits, regular, small, frequent meals, uh, avoiding fried foods, fruits and vegetables. These are the things which can help you to live longer in quantity, also in quality.
That's great. Thank you so much, Dr. Hazra, for sharing your insights and expertise with us and spreading the word to prevent heart diseases and to spread this awareness around heart health on this special occasion, World Heart Day. Thank you so much for coming to our platform and giving us your time on this special occasion. Thanks a lot.
Thank you. Thank you.